You've probably found hair on your pillow, in your brush, or circling the shower drain, and quietly panicked. But do you actually know why you're losing it? Because hair loss isn't one problem, it's many. And today, we're breaking it all down. First, not all hair loss is permanent. Your hair grows in cycles, some strands growing, some resting, some falling out. So losing 50 to 100 hairs a day? Completely normal. That's not balding, that's just biology. The concern is losing noticeably more than that, or thinning over time. And here's the most important thing to understand. Not all hair loss is the same. Some is non-scarring. The follicle survives, and the hair can grow back. And some is scarring. The follicle is destroyed for good, and the loss is permanent. Most hair loss is reversible, so let's start there. The most common cause? Genetics. It's called androgenetic alopecia, or pattern hair loss. A hormone called DHT slowly shrinks your follicles until they stop producing visible hair. It affects a large proportion of men and women over their lifetimes, becoming more common with age. Then there's stress. A major illness, surgery, childbirth, or an emotional shock can push your follicles into shedding, usually 2 to 3 months later. The good news? It's temporary. The shedding settles within months, though full regrowth takes longer. This one has a name, telogen effluvium. Chemotherapy and radiation cause rapid loss too, but the follicles usually survive, so hair grows back once treatment ends. Sometimes it's autoimmune. In alopecia areata, your immune system mistakenly attacks your own follicles, leaving smooth, round, bald patches. Sometimes it's an infection. A fungal infection of the scalp, common in children, leaves scaly, itchy, inflamed patches. Sometimes it's behavioral. Trichotillomania is a strong, hard-to-resist urge to pull out your own hair. Not a habit, a real, treatable condition. Sometimes it's your hairstyle. Tight braids, buns, and ponytails pull on the hair for years until the follicle gives up. That's traction alopecia. And sometimes, hair loss is a messenger. Thyroid problems, iron deficiency, hormonal changes like pregnancy or PMOS, even certain medications. Treating the underlying cause often improves or reverses the hair loss. But here's the serious one: scarring alopecia. Inflammation destroys the follicle and replaces it with scar tissue. Once it's gone, it's gone. The warning signs? It can include scalp redness, scaling, burning, itching, pain, or areas that appear smooth and shiny. This is the one you cannot afford to ignore. And aging? It can contribute to thinner, slower-growing hair, but genetics and hormones are often the biggest drivers of significant hair loss. So what do you do about it? 1. Don't panic and don't self-diagnose from the internet. 2. Be gentle. Loosen tight hairstyles before they cause permanent damage. 3. Eat well. Your hair needs iron, protein, and nutrients to grow. 4. Manage your stress and protect your sleep. Your follicles feel both. And 5. See a dermatologist, especially if there's pain, scaling, or scarring, because the cause decides the fix, and only a professional can tell you which one you have. If your hair loss is sudden, rapidly worsening, patchy, or accompanied by scalp symptoms, seek medical evaluation. Hair loss can be temporary or permanent, harmless or a warning sign. Know the difference. Act early. I'm Neka. Follow me at MedWithNeka because your health starts with knowing.